so thank you so much, everybody, for coming today. We're really excited to hear Dr. Nicky Wright speak today. She's a lecturer from the Department of Psychology at Manchester Metropolitan University. And most recently, she came from the Biostats department at the IOP. And she's worked with the World Child Health and Development Study, which I believe she's going to speak about today. Nicky Wright's research focuses on using advanced statistical methods to identify risk and resilience processes in child and adolescent mental health problems. She's using prospective data to understand the impact of the COVID-19 pandemic on child and parent mental health, a subject that many of us are very keenly interested in. So please welcome Dr. Nicky Wright to speak on the impact of COVID-19 on young adolescent depression and behavioral problems. Over to you, Nicky.
Thank you so much. So today I'll be talking about some data from the World Child Health and Development Study, as Sharon mentioned, where we have been examining the impact of the pandemic on young and adolescent mental health. And today I'll be talking about an analysis where we attempt to separate out the pandemic-related effect from age-related effects on symptoms of mental health, using data that we've collected repeatedly pre and post-pandemic. So just to set the scene by explaining about the World Child Health and Development Study, we are a prospective birth cohort study, not as large as many of the other birth cohort studies. We started off at 1,200 and now at age 13, we have about 800 families. We typically get data from about 750. So, but the sample were consecutively recruited in the antenatal clinic, first-time mothers, and their children and their partners are taking part in the study, and we've been following them up repeatedly up to currently age 13 years. So the lead investigators on the study are Professors Jonathan Hill, Helen Sharp, and Andrew Pickles, who are at Reading, Liverpool, and King's College universities, respectively, which explains my affiliation to all these universities. So the study was originally designed to look at social, emotional, and biological processes in emergent conduct problems. The first 14 waves of funding were funded by the MRC, involved in-depth, detailed, hour-long assessments repeatedly throughout childhood, collecting all sorts of measurements. The last two waves we've funded with multiple different sources, with really a focus on just ensuring we keep getting these mental health and family functioning outcomes throughout early adolescence. And we were conducting a wave, which was just a questionnaire wave with our families, what we called age 11, when the pandemic hit the UK in March 2020, which afforded us with this opportunity to conduct a high quality analysis of the impact of the pandemic on young adolescent mental health, as we had this mental health data that we collected immediately prior. So just to show you where the Wirral is, it's in the northwest of England. It's next to Liverpool. It's a peninsula bounded on three sides by water, and it has a good representation of the full range of socioeconomic statuses. And in particular, the Wirral has quite a high proportion. So 40% of the Wirral are in the most deprived quintile of UK neighbourhoods. So we have a good representation of different socioeconomic status in our sample, and our sample is representative of this population from which it was drawn. So just to set some context on the research question, we're all aware that there's widespread concern regarding the impact of the pandemic and the associated lockdown and social distancing measures on the mental health of children and adolescents. A lot of research has been conducted on this topic, and which has already been summarised in a number of reviews. So collectively, this evidence suggests that there has been an increase in mental health symptoms, and there is some suggestion that this is more marked in girls and in older children in adolescents. So the evidence out there is a mix of different types of studies. So the vast majority of evidence is based on cross-sectional prevalence studies. So a COVID survey has been rolled out during the pandemic to assess mental health symptoms, and then prevalence is compared to prior estimates that have been published, or perhaps in some cases like the NHS surveys, prior surveys that have been rolled out but with different people. So whilst these give us an indication of changes in prevalence, there's all sorts of issues with it not being the same people. There's lots of different factors. So what we're all familiar, many people here work on cohort studies. So the evidence that we're most familiar with is studies where there is prospective mental health data. So where mental health data was collected prior to the pandemic. So therefore, then we can examine for a change in symptoms in the same people. So most studies are in the situation where they have data collected several years prior. So there is this issue with the passage of time. And the kind of best situation to be in, which is the situation that our study was in, was where you have data collected immediately prior to the pandemic. So you collect data in the 6 months, say, or the 3 months prior to the pandemic, and then data afterwards. And then we get the kind of best handle on whether a change in symptoms has been associated with the pandemic. The passage of time issues aren't so great. So there's very few studies like this, very few included in these reviews, certainly. But I'm preparing the analysis that I'll talk about today for publication, which is on adolescents. So I've now narrowed my focus to adolescent studies only, and identified that there seem to be 9 prospective studies of adolescents which have pre-pandemic measurements. Some of these have immediately pre, like our study does. Most of them have wide age ranges. So we have quite a narrow age range of 11 to 14 years in the sample that I'll talk about now. Often studies will have an age range that spans adolescence. But overall, the evidence seems to suggest that there has been an increase in depression, not an increase in anxiety symptoms. And then the evidence on behavioural problems is inconsistent. Far less studies look at behavioural problems in adolescents. There just isn't as much evidence out there. So last year, we published our initial COVID impact analysis. So this was using the data that we collected immediately pre to the pandemic, and we then assessed those same families 3 months post onset of the pandemic. So we had our pre around 3 months prior, and then our second measurement was taken in June. So just when the serious lockdown restrictions were ending, but what we refer to as the lockdown period. So this was a subsample of our wider sample, because as we're a development study, what we've always done is roll out our assessments in age order. So we assess the oldest children first, and then we keep following that along to try and get everybody at the same age. So we'd only rolled out our wave to the oldest children, but we've been able to show that this subsample is representative of the wider sample. So then using this data, we were able to show that there was an increase in depression and in behavioural problems in these 12-year-old children from pre to post-pandemic. And similar to many other studies, we didn't find any change in anxiety. And this was mirrored in the mother's mental health as well. So we saw an increase in depression in the mothers, but not an increase in anxiety. We didn't find that girls were disproportionately affected, which is often what's concluded. So the increases were similar in boys and girls, but girls showed higher absolute rates. Girls were elevated prior to the pandemic relative to boys, and elevated post-pandemic. So they do have higher levels, but they weren't disproportionately affected in the analysis that we did. So at the moment, so I've been keeping an eye on the literature, and at the moment, I'm not aware of any studies which have tested whether this initial increase that many studies observed in the 6 months post-pandemic has persisted a year later. So that was the main question that we were addressing with the analysis I'll discuss today. We wanted to know whether this increase persisted. And something that we were very mindful of as developmentalists, and as COVID changed the nature of our assessments, was that during this period that we're looking at whether the pandemic has an impact on depression symptoms, we would probably expect developmental change, well, we would expect developmental age-related changing, particularly in changes in girls' depression. So our sample was recruited over 21 months. So they do, in the 3 time points that we have, so pre-pandemic, post-pandemic, so lockdown we call it, and a year later, they range from 11 to 14 years. And we know from existing evidence that over that time, we expect an increase in girls' depression symptoms. So, for example, Pravitha Pathale reported from the Millennium Cohort study several years ago that the proportions of girls and boys in their sample above clinical cutoffs for depression at their age 11 sweep and then at their age 14 sweep. So at age 11, boys and girls were both around 12%. By age 14, girls meeting the threshold for depression was up to 24%, it doubled, whereas boys had stayed the same. So we're aware that over this period where we were comparing 3 different time points of depression symptoms, there was actually going to be a lot of developmental change there, which we were confounding with the pandemic effects, and that none of the analyses that we looked at had really attempted to separate out these age-expected maturational effects from the effects of the pandemic. So that's what our questions were. So firstly, is the increase in depression and behavioural problems we observed and maintained 1 year later? And do these effects persist after taking account of age-expected maturational effects and symptoms? So I've mentioned our sample, which is the Rural Child Health and Development Study. These were just our 3 measurement points. So pre-pandemic measures were collected December 2019 to March 2020. We paused the wave as soon as the pandemic was declared, and we'd collected data on a subsample then. Then in what we call lockdown on the figures in the next slide, so I'll start using that term now. What we did then was, in order to get mental health data in relation to the pandemic, we approached our whole sample all in one go, which is not something we've done before. So we wanted to get data in relation to the pandemic rather than getting them all at the same age, which is what we've normally done. We got 729 responses then. Then a year later, we've gone back to the whole sample again. What we tend to get is 50% take part straight away, another 25% in the next month or so. And then we do keep collecting data. In order to get data on everyone, we do keep collecting data. But for this purpose, we've stopped here at January 2022, just to get kind of a narrower range of time in relation to COVID. But that collection is still ongoing. So we have our 3 time points: pre-lockdown and post-lockdown, we refer to them. So to measure young adolescent depression, we use the short mood and feelings questionnaire. For this, we collect both young adolescent and parent report. And we consider the young adolescents report to be our primary outcome. Typically in adolescence, by adolescence, we expect children to be able to reflect on their internal experiences, and you are generally you're the best reporter of your own internal experiences and emotions. So we do consider the young adolescents' report of their depression to be the primary outcome, but I'll discuss the parent report findings, and we'll discuss them in the discussion too. Behavioural problems we assess using the child behaviour checklist aggression subscale. For this, we only collected parent reports. We assume that the behavioural problems are external observable behaviours that parents can report on. Part of why we haven't collected child reports of this is that we are limited to how much we can ask these children to do at home. The Wirral study traditionally was a face-to-face assessment study, and then we've had to switch through lack of funding to asking them to complete these questionnaires at home without our support. So there is a limit to what we can ask the young people to do now. And then in the models where we do use parent reports, we have included mother's own depression, just because we're aware of there's a mood bias of mother's own mood on her reporting of her child's symptoms. So we wanted to account for that. So for the analysis, this repeated measures models, looking for change over the 3 time points. We look at boys and girls separately. When it's parent reported outcome, we control for parents' depression. So our initial analysis was the same that we conducted for our paper last year, and that most other studies carry out, which is just looking at a change in symptoms across the 3 time periods. Then we ran a second analysis where we included age as a time varying covariate to try and account for these age-related changes in symptoms. And as we'd shown that this subsample that we had pre-pandemic data on didn't differ from our wider sample, which is representative, we use maximum likelihood to make use of the full sample in the analyses. So these are unpublished findings, which I haven't actually finished writing up yet. So I've just got this watermark on here. I'll discuss young adolescents reported depression, so self-report of depression first. This figure is just to illustrate the spread in ages and the overlap in the spread in ages that we have because of the nature of the pandemic-related assessments. So as I mentioned, the pre-pandemic measurements, the red, we rolled out with the oldest children first. Then when it came to the lockdown, we rolled it out to everybody. And then even a year later, post-lockdown, there's still a lot of overlap because the sample do vary in age over 21 months. So this is just the spread of ages we have at the 3 time points here. So this figure shows the changes from over the 3 time points uncorrected for age. So the difference, and the first 3 bars are the girls and the next 3 are the boys. And the first two columns are what we reported in our JCPP Advances paper last year, except now we're making use of the full sample. And we show that there is a significant increase from pre-pandemic to lockdown in both boys and girls. And that for girls, this seems to have worsened a year on. So girls' symptoms have significantly increased again. Whereas for boys, their symptoms seem to have dropped down, not quite to the level of pre-pandemic, it's not a significant difference, but their depression symptoms seem to have dropped down. The rise in depression observed initially isn't maintained. So then we have this figure here, which shows the maturational trajectories over the age from 11 over here up to 14 on the right of the plot. So the solid lines represent girls and the dashed lines represent boys. So I'll just flag, first of all, the overall pattern. You can see that for girls, over this age range, we are seeing a significant increase in depression symptoms from age 11 to 14 years. So this is plotting the age effects. The lines represent the three different the separate lines in the different colors represent the different time points, but overall we can see that girls' depression symptoms increase over this time. Whereas for boys, there does seem to be a decrease, not a significant decrease, but certainly the trend is for their symptoms to decrease over this age range. So this isn't as established, and certainly wasn't what the Millennium Cohort Study reported, but there is a paper from Alsbach, so another big birth cohort study, which suggests that boys' depression symptoms decrease over adolescence. And I'll show you a plot which really illustrates the pandemic effects after accounting for age more clearly, but you can just note here that there isn't much separation between the lines for the girls, the solid lines representing the three different time points, a bit where there is some separation for the boys, with it looking like their post-COVID onset time points scores are elevated relative to pre-pandemic. So that's what we see here in this figure, which corrects for age. So to show you this corrected for age, this figure assumes the median age, so a child that's aged 12.5 years, and shows the adjusted means for the three time points for a child that age. And the most striking thing here is that this significant increase in girls' depression, which we observed from pre to lockdown, and then again from lockdown to a year later, is now has been removed essentially. So it's now certainly non-significant. There's a slight increase in the lockdown, which has dropped that down by post-lockdown. Whereas for boys, this significant increase remains, and there is a maintenance of their depression symptoms a year later. Whereas in the uncorrected analysis, it looked like their depression has dropped down. Once we correct for their natural maturation of symptoms, which is a slight decrease as they age, we see that their increase in depression symptoms has been maintained. So essentially what we're seeing here is that after correcting for the natural progression in depression symptom in girls, the effects we attributed to the pandemic have been reduced and removed. So I mentioned that we also have parent report of young adolescent depression. So the uncorrected analysis from the parents is almost identical to the young person's report of their own symptoms. So a significant increase in depression symptoms from pre to during the lockdown, which is maintained for girls, and for girls' own report, it did significantly increase, but there is an elevation there, which isn't significant. Whereas for boys, there is an increase, but this has not been maintained and their symptom levels are dropping down a year later. So again, we plot by the child's age, the trajectories of symptoms from age 11 to 14 years. And what's striking here is that the mothers don't report this increase in depression symptoms in girls that we see using youth reports. So there's a slight upward trajectory there, but it's not significant at all. Whereas for boys, this decrease in symptoms from 11 to 14 is more marked. It's now significant and steeper. And what you can also see in this figure is that there is this separation in the lines that represent the three time points, which we'll see in the figure here. After correcting for age according to mother's report of youth depression, there is a significant increase from pre to lockdown in girls. That has not been removed, correcting for age as it was in the youth's report, which is there for boys. And for girls, similar to the uncorrected report, this has been maintained a year later. Whereas for boys, now what we see is a significant, after correcting for the age trends, there is a significant increase 1 year later again. So the correcting for this downward trajectory in boys has really revealed that the boys not only showed an increase with the pandemic, but this has worsened a year on. And I'll just finish talking about the behavioural problems. So for this, we only have the parent report. So uncorrected for age, similar to depression, we see that there is an increase associated with the pandemic. And for both boys and girls, this is maintained a year later. Looks slightly elevated for girls, slightly decreased for boys, but overall we conclude that there's an increase with the pandemic that's maintained. Plotting the trajectories over this time, we see that for both boys and girls, there is a slight decrease in behavioural problems from age 11, to age 14. So it's not significant in either sex, but you can see that it's a downwards trajectory over the age range. So behavioural problems should be decreasing over this age. And you can see that there is some separation of the lines here, which I'll illustrate in the figure here, which assumes a child age of 12 and a half. So what we see now we've corrected for age has really helped clarify the picture for girls. So girls showed a significant increase with from the pandemic to lockdown, and then a year later, girls' behavioural problems have significantly increased again. The pattern is the same in boys, but that increase isn't significant. But certainly the increase associated with the pandemic in boys has been maintained a year later. So I will go over some summary and implications of the findings now. So the simple uncorrected analysis that we did suggested that there was an increase in depression and behavioural problems in girls and boys from pre-pandemic to the lockdown. That this increase in depression is maintained in girls only, and that behavioural problems increase was maintained in girls and boys. But just to remind you of these age maturational effects, and I am considering the youth zone report here, I will discuss the difference in reporters in a moment. So that over this time, this age range, depression symptoms increase in girls, but decrease in boys. Whereas behavioural problems slightly decrease in both boys and girls. And just to kind of illustrate this further, this increase in depression rates in girls, I've reported the proportions over the cutoff, the clinical cutoff on the measure that we use. So at age 12, we saw that 1 in 5 girls showed clinically significant depression, and at a mean age of 13, it was 1 in 4 girls showed clinically significant depression. So this is in the overall sample. And after correcting for this age-related increase, we see that the pandemic has not added to the risk for depression in girls. So the risk that is conferred by their increasing in age, the pandemic has not added to that. Whereas for boys, there was this age-related trend of decrease in depression over early adolescence. So at mean age 12, 1 in 10 boys met the clinical cutoff, and at age 13, 1 in 15 boys met the clinical cutoff. After accounting for this age-expected decrease in symptoms, we can conclude that the pandemic has added risk for depression symptoms in boys, and this has been maintained 1 year later. And then for behavioural problems, we did see this age-related trend of decrease in behavioural problems. So consistency, I've reported the clinical cutoffs, but because we use the CBCL, it has sex-specific and age-standardised norms. We don't see a change in proportion above the clinical cutoff, like we might with the mood and feelings questionnaire, which uses the same cutoff for everyone. But so just the consistency at age 12 and 13, around 1 in 10 boys and girls meet clinical threshold for behavioural problems in our sample. But after accounting for this age-related decrease that we observe in the raw scores, we can conclude that the pandemic has added risk for behavioural symptoms in girls, which is increased further a year later, and added risk in boys, which is maintained a year later. So some of the take-home messages from our analysis are that, according to their own reports, this apparent increase in girls' depression we attributed to the pandemic is actually explained by age-related change in depression symptoms. And importantly, because what seems to be out there in many papers I see now and concluded in some reviews is that girls are disproportionately affected, what's actually happening is because boys are showing this decrease in symptoms over time, we may be missing a pandemic related increase in boys' depression because overall they experience a decrease over time. And similarly, we may be missing pandemic related increases in behavioural problems because overall there is this pattern of decrease over, certainly this is over early adolescence, 11 to 14 years. So I think what we take away from this is that we need to keep our developmental hats on. So when we're critically analysing research studies, when we're working clinically with children, we need to remember that there are natural developmental maturational changes in symptoms, especially in certain time points, early adolescence being one. And we need to remember that. So if we're seeing a child clinically at 11, you need to take into context the fact that we may expect their depression symptoms to increase naturally with development. So you need to interpret any change within that context. But the overall conclusions from the analysis we've done is that the increases in depression and behavioural problems that we have observed during the lockdown have been maintained a year later. And I don't want anyone to take away that the needs of boys are greater than the needs of girls, because ultimately the clinical needs are still highest for girls. Their rates of depression are still the most elevated overall. It's just not necessarily, they've just not necessarily been disproportionately affected by the pandemic. And something that is out there in the literature, and we included in our past paper, and we'll certainly explore, is that of course there are likely subgroups of children who are more adversely affected than others by the pandemic. So, for example, we've shown differential effects based on past mental health problems in our last paper, which is something we will explore now. Just some thoughts to finish on. So I've mentioned that we consider self-report of emotional symptoms our primary outcome, so the youth's own report of their depression. And that for boys, the results according to their mother's report of their depression and their own report of their depression were really similar. And the behavioural problems were very similar too. It was all a very similar picture, whether you use mother or youth report. Whereas it differed for girls. So for girls, mothers didn't report this increase with age that the young people reported for themselves. And in the mother's report, there was an effect of the pandemic. So something we've been puzzling on is, why do mothers and daughters differ in reporting of daughters' depression? So something we thought it might be, and there's really not enough out there, I think, on how depression presents differently in males and females, whether it does, and whether that's part of it. So could it be, something it could be is that boys' depression presents more behaviourally, and therefore it's easier observed by mothers, and so therefore there's more agreement in the report between the two. It may be that there are differences in relationships that affect reporting. So maybe that's why mothers are better able to report on their son's depression symptoms. We know that girls go through puberty earlier, certainly in our sample that's the case. So perhaps there's been a turning away from mothers by the girls, which means with puberty, which means that the mothers report depression symptoms differently. Or it may be that the mothers are a more accurate reporter of the girls' depression symptoms. We constantly have this problem in developmental psychology of fairly low agreement between different reporters. We would consider the young adolescent to be the more accurate reporter of their own experiences, but we're just at the moment thinking about different explanations for why these different results have arisen. Because if we'd have only collected parent report, then we wouldn't have seen this age-related explanation for the girls' increase in depression. According to mother's report, the pandemic effect on depression was there for boys and girls and was maintained. And just to finish on just flagging that there are less studies on behavioural problems in adolescence, because it does seem to be that once you get to adolescence, behavioural problems get neglected and the focus is very much on emotional problems. And what we've seen is that there is a pandemic effect that survives age correction on behavioural problems in boys and girls. And actually for girls a year on, there's a significant worsening again in their symptoms. And there are features of the pandemic that you could think would be particularly problematic for behavioural problems. So children being out of school, even once back in school, continued school disruptions from further lockdowns, from having to self-isolate, from all sorts of different factors that are disrupting school. So this kind of lack of structure. And then again, there's this possibility, children at home more, increased exposure to potential negative home environments. So I think it's worth keeping in mind that we are seeing an effect of the pandemic on behavioural problems and thinking, what are the implications of that for the future? So that's something that we'll continue to follow up in our children. So just to finish, acknowledging the WICHAD study team, incredibly grateful to everyone who contributes to the work, and of course to all the families who make this possible. And thank you so much for inviting me today and allowing me to talk about this work.
Great. Well, thank you so much, Nicky.